Welcome to the Dental 18 podcast. We're your hosts, Kiera Dent
and Dr. Mark Costas.
Mark and I had this crazy idea that maybe we could combine a dentist and a team member's perspective because let's face it, dentistry can be a challenging profession with those two perspectives. And Dental 18 podcast was created.
I'm a practicing dentist, a multiple practice owner, a dental performance coach, and the founder of the Dental Success Institute.
I've been a dental assistant, treatment coordinator, scheduler, biller, office manager, current practice owner, and international dental consultant. Mark and I don't just understand you, we are you.
Our goal is to positively impact the world of dentistry by sharing our lessons learned from the road in hundreds of dental offices.
Two perspectives, one mission, to help dental professionals reach their full potential. Welcome to the Dental 18 podcast. Hello, Dental 18 listeners. This is Kiera Dent, and I am once again coming to you with Paige Benjamin. Paige, how are you today?
I'm so good. How are you?
I'm great. It's early morning. Paige was kind enough to wake up early. You guys all know I like to podcast early in the morning. So, you know, Paige, you're my first conversation of the day. It feels pretty good to dive right into podcasting.
Yeah, it's awesome. And you're more of a morning person than I am, but it feels good to get up and get going in the day.
Right? It always does. It always does. So as you guys know, as you remember from the last podcast with Paige, Paige is she's the hygienist. She's our dream hygienist. She's the one who works on our hygiene consulting team. She works with lots of hygienists and she's a rock star. She knows how to do every position. So I am excited to have more hygiene on this podcast, talk to our hygienists out there. So Paige, let's dive into hygiene this morning.
Yeah, sounds great.
Alrighty, you take the lead.
Well, yeah. So the topic that I was kind of wanting to go over today was Perio. And hygienists, if you're listening, you're just cringing. I know. Doctors probably just cringing. It's just one of those things that you don't want to do. It's like the number one most underdiagnosed procedure in dental hygiene. So why is that? You know, why is it scary? What is stopping the hygienists and doctors from diagnosing perio?
I don't know. What is it like? And when you say they're cringing, what is the reason for hygienists to cringe? And because I would think perio is your favorite thing as a hygienist because you get to get down in there, you get to clean it all out. I feel like that's what hygienists want to do. But what is the reason for the cringing? What is the reason for underdiagnosing, do you think?
You know, I think it's confusion and lack of confidence in diagnosing. Number one. Number two, I think a lot of people struggle with having time to probe or thinking that they don't have time to probe. Mm-hmm. And if you don't probe, how in the heck do you think you're going to diagnose anything?
Right.
If you don't have those measurements, if you don't have anything to go off of, you're not going to feel confident. You're going to feel confused when it's time to diagnose.
Yeah.
And another thing is, I think that hygienists and doctors want to avoid having that quote unquote hard conversation with the patient.
Yes.
And I think that's what it boils down to is those three things.
Okay. So let's dive into those three things. Let's attack them all because ultimately we don't want to underdiagnose for our patients. We are healthcare professionals. That's what our job is. That's what we do. That's why patients are coming to us. And I think a lot of times, I don't know, I'm not a parent, but I feel it's almost as if we're trying to be their friends. We don't want to step on their toes. We don't want to make them feel bad. But at the end of the day, our job is to be loving and kind for certain, but it's also to be a healthcare professional that is diagnosing, it is educating, it is telling our patients, and it's not just beating around the bush and sugarcoating what we think they want to hear.
Exactly. So, it's so hard because perio is not black and white. And I think that's why it's so confusing for a lot of people. There's so many factors to consider when diagnosing perio. Bone loss evident on radiographs, pocketing, bleeding on probing, systemic conditions, all of those things contribute. It's not just one thing that when you see it, you go, perio. And that's why people get confused. You have to look at a lot of things. But the one thing that I can tell you, and the biggest red flag you should be looking for upon your assessments is bleeding. Okay. Bleeding indicates active disease. Healthy gums don't bleed. So if there's bleeding going on, you need to look further into that spot. What's going on right there that's causing those gums to bleed? Because that's not normal.
Gotcha.
So bleeding is going to be the number one indicator.
Okay. So give us kind of a breakdown. So how often, because you have to start with the full mouth probing. So how often do you recommend that we full mouth probe And how do you actually do that? Because I think that's one of the biggest complaints that I get. One of the hardest things, and you and I chatted on our last podcast of switching your brain, thinking, what if I could do it? But let's just talk about how often you probe and how you can do that and how long it usually takes you to full mouth probe.
Yeah. So I recommend probing every single appointment.
My eyes just got big. That is totally not what I was expecting. So tell more, Paige.
So I probe at every appointment. Once a year, I record my findings. So I record a full mouth perio chart one time a year. At every appointment, I do probe and I record any changes. So I'll look at the chart and I'll just start going. And I'll just be looking up at the chart, not moving my hand, not doing anything. My hands are in the mouth, but I'm looking up at my screen as I go. And if there's a change, I record that change only. Doesn't take very long.
Okay, Paige. So when you're doing this full mouth probing, where's your screen at? Because you do it every single time, and you said you're looking, your hands aren't out of the mouth. Where is your screen? Like, give us a good visual of how you have your room set up, just so the hygienist can have a clear picture of what you do.
So I'm fortunate enough to have one behind me and one in front of me. So it doesn't matter where I'm sitting, I can always see a screen. But if you're not fortunate enough to have two screens, then in our last podcast, we talked about grabbing a team member to come help you chart. Mm-hmm. Just grab someone to come help you. As you call them out, they just chart the changes. Don't hesitate to have someone come in and help you. Chances are someone is around. Someone is not doing something, or someone has a break. Someone's waiting for the doctor. Someone can help you for 2 minutes. I promise.
And if you're fast and it's only 2 minutes, even the front desk can come and help. I didn't mind helping go back there. As long as I knew that you guys needed help, I had no problem. Just ask me and let me know.
Yeah. And if you are consistently quick, which you will get quicker the more you do it, people will be more likely to come help you because they know, oh yeah, she's asked me to do this before and she's super quick. Let me just go help her really fast.
Yep, exactly. Okay. All right.
So yes, I do probe every single patient a full mouth, but I don't necessarily sit down and chart the whole thing by myself every time.
Okay. All right. And you're looking for the changes, and it's easy in the software. You don't have to redo. Once it's in there one time in the computer, you can just copy it for a new exam and then change the ones that change. And hopefully our patients are doing a good job and not having massive changes every single time they come in, but it really should. I feel like it's the first one that's your longest one. And then after that, hopefully it's pretty standard and just a few changes here and there. Is that accurate?
Yeah. Yes.
Okay.
I would say so.
Perfect. Okay. So you full mouth probe every single time. Now what happens the next page? Where do we go from here?
Yeah. So once you do your whole assessment, look at your probe readings, look at, you've recorded any bleeding. You can look at the x-rays that you took. If you see radiographic calculus, if you see radiographic bone loss, there's a conversation to be had, right? Mm-hmm, now, going back to the confusion and the lack of confidence in diagnosing, one thing that will really help is a calibration meeting between the hygienist and doctor. I know that there have been times where the doctor and I haven't been completely calibrated in an office, and I will diagnose, we're not supposed to diagnose, but co-diagnose and let the patient know, this is what I'm seeing. This is the direction we're probably going to go. Let me have the doctor come in and he'll take a look and confirm. And the doctor will come in and, I had all this confidence. I talked to the patient about it. I had that quote unquote hard conversation with them. I'm feeling on top of the world. Really good. The doctor comes in and says, I think we can just do a prophy. I think we're going to be okay. It's not really as bad as I don't think it's that bad. And you just melt into a puddle of goo and you think, I'm never doing that again.
Right. Exactly. Because it just took it really does. That was a hard conversation to have. And then lo and behold, who are you? You're
exactly. And you feel embarrassed.
You do.
And so you think, I'm not doing that anymore. You shut off to that whole idea. And you just do bloody prophies and a whole bunch of hard work for free.
That's a good point. That's a good point. You've got to have your doctor back you, and you and the doctor need to be on the exact same page with this. That's a really good point.
Exactly. So if you and your doctor are on the same page and you have these calibration meetings, if you want to do it once a month, whatever it is that you and the doctor feel like you need in order to stay calibrated and confident, do it.
So
it will be worth it.
How would you have one of these calibration meetings? What would that look like? How do you do this with your doctor?
Yeah. So it can go a lot of different ways, but the biggest thing is just initially talking about perio. What do you think perio is? What do I think perio is? Because people are going to have different ideas, and you can't just say this is going to be perio from here on out, because what if the hygienist says, I don't really agree with that. I don't, that's not really perio to me. Or same with the doctor. What if the hygienist is very aggressive and the doctor is like, I'm just not quite that aggressive, and I think we could do one more prophy, or whatever it is. Discuss it. That way, whenever you two come to a final decision, you're both comfortable with it. If one of you is uncomfortable with how you're going to diagnose, you're not going to do it.
That is correct. We've got to believe in it. Otherwise, you can't have that confidence. You're not going to have that confidence to tell your patients, because you're not behind it.
And you can't sell or talk about something that you don't believe in.
Absolutely. Absolutely. Okay. So you and your doctor, you get calibrated. And just as a general, I've heard offices where it's 4 millimeters and above with bleeding. That's perio. Others say, whoa, that's super aggressive. We're 5 millimeters and above with bleeding. Others are, well, let's look. I went to the dentist yesterday and I had a couple of 4s, which made my eyes pop out of my sockets. And she said, you've got a little bit of bleeding. And I was like, oh my gosh, you could strike me up as perio right now. And I thought I'm a pretty healthy human being over here. And I do, let's be real, I don't floss super often. I'm just going to confess it, but I have made they said it's going to be an Easter's resolution for me. So I'm totally rolling with that, an Easter's resolution. But the reality is, the reason I had it was because I just don't floss every single day. That's bottom line, end all be all while I've got it. But yeah, if you guys are solid of 4 millimeters and above with bleeding, I straight up had perio in every single pocket or every single quadrant yesterday. That would have been, but yet I didn't have it. So Paige, how do you navigate this? Because you're right, there's no black and white lines on how to diagnose perio. So what else do you look for beyond just a certain millimeter pocket depth and bleeding? Because you said it is bleeding that's also the cause of perio.
Yeah. You want to look at bone loss. You want to look at, are you stressed? How's your nutrition? Are you taking any medications? Things like that. So like I said, it's not black and white, and it's not just you have perio because you have a 4 millimeter and bleeding. So you have to look at all these different factors, and not every patient is going to be the same. So I have a hard time giving you an exact, this is going to be perio. But where you had bleeding, that is something to look into. Okay, Kiera, you have bleeding and you have pocket depths that are deeper than we feel comfortable with, deeper than we like. So tell me about your life. Are you stressed out right now?
Kiera doesn't stress. Never at all. I'm beyond stressed. That's where my life is.
Those things play a factor. Kiera, are you flossing? No, that might be part of it. Generally, you're pretty healthy. The rest of your mouth looks pretty healthy. Let's educate the heck out of you, send you home, and have you floss because it's your Easter's resolution.
It is.
And we'll see you back in 6 months. And we're going to really assess this one more time. If it hasn't gotten better, we're going to look into this a little deeper. But where you're generally healthy, this has never happened before with you. We're not just going to, beat you with it. We're going to really take a close look. We're going to assess you. We're going to keep an eye on you. We're going to give you some really good home care tips. And we're going to send you on your way. And then next time we're going to reassess it.
So what would be some good home care health tips? I'm just asking for a friend, just a friend. That's all.
So definitely brushing. If you have an electric toothbrush, that can help a lot of people. A lot of people struggle with dexterity if they have arthritis or if they have anything. Do you have an ultrasonic, an Oral-B? Do you have any sort of an electric toothbrush? Okay,
I do.
Perfect. So as a healthcare professional, I would say, show me how you're brushing. Let me see the angle. Let me give you some tips on give you that 45-degree angle. Because when I talk to my patients about that 45-degree angle and little circles, they look at me like, what the heck is a 45-degree angle? Where? Toward my cheek?
We are not in geometry anymore. What are we talking
eyeballs,
about?
like my tongue. Yeah. What are you talking about? How? And so I have to show them. And then I give them a mirror and I have them demonstrate for me so that I know you've got it because you did it for me today. I didn't just tell you. I didn't do it for you. You showed me before you left, so I know that you can do it. C-shaped flossing.
Yep.
A lot of people pop the floss in and out. And when I tell my patients and show them and demonstrate, they are just in awe. And a lot of them say, I've been doing this wrong my whole life. And I said, well,
lucky for you. Let's learn this.
Yeah. So C-shaped flossing, you've got to get all the way down to the base of the pocket. Really got to get all that bacteria out. Mm-hmm. If you have a water pick, rinse with something. You got to swish, get any food, bacteria out. Rinse. Swish with water. Swish with anything after you eat so you can get any food or debris out. Those kinds of things are getting in your pocket and they're irritating the base of that pocket and causing that bleeding. So
there you go.
Really just educate the heck out of the patient. Uh-huh. When they come back in 6 months, reassess. If it hasn't gotten better, then something needs to be done. But chances are it's just a weird little thing. Kiera is just too stressed out right now. And she's not flossing because she's so stressed out.
Per the hygienist recommendation, I'm just taking the next 6 months off. I'm going to be on the beach, guys, just taking it easy. I got to get these 4s down to 3s. That's where I'm at. But no, that's really, really helpful. And I like it and I wanted to use myself as an example because I think a lot of times this happens and it's not the black and white. It's not crystal clear. And this is where perio is so tricky. It's so sticky because it isn't black and white. And I think people err so much on the gray. And when you were saying you have this hard conversation, I actually wanted to dive into that because when I was thinking, when you said that hard conversation, I realized, yes, it is a trickier conversation, but I wanted to know, why is it a trickier conversation? It shouldn't be. You are the healthcare professional. You're not telling them they have cavities and root canals and implants. You're simply telling them that they have some infection under their gums that we need to clean out. Why, if that is our job as hygienists and healthcare professionals, why should that even be considered a hard conversation? And I really want to dive into that because I think a lot of it's psychological. I think so much of it is the story we've told ourselves that this is a hard conversation. So dive into that a little bit more, Paige, from your world. Why does it feel like a hard conversation to you or to other hygienists that you chatted with?
So here's the thing. People say, oh, that's a hard conversation. Right. But it doesn't have to be hard. Right. So the only reason you think it's hard is because you're not doing it very often. When you do have to do it that one time every 6 months because you haven't been doing it, you are terrified. You're not rehearsed. You haven't role played. It's not just second nature. It doesn't roll off your tongue like it should. That's why it's so hard, is because you haven't been doing it. So I'm just going to say it. I signed up for a marathon.
Woohoo!
Paige is out there.
Way to go, Paige.
You've run a marathon, right, Kiera?
I have. Just one. But when is your marathon?
It's in September.
Okay, maybe I'll train with you. What marathon are you doing?
I'm trying to remember what it is. I signed up for it and I don't even know the name of it. It's in Utah somewhere.
That's fine. That's totally fine. At least you did it. Okay, so you signed up for a marathon. This is exciting.
So here's the thing. If I just got out there and ran the marathon, that would be the hardest thing of my life, right? Mm-hmm. But if I do the training plan and run the 2, 4, 6 miles, if I get up and I'm running every week and I'm putting in the miles, getting out on the road, getting on the treadmill, whatever it is, that's not going to be the hardest thing I've ever done. I'm not going to die during that race because I'm not just getting out and doing it once. Right. I'm training. I'm getting out there every single day. Last night, I was going to go to our gym. Well, my husband was gone and had the key. And I thought, oh, darn, guess I can't run today. And I thought, no. Get out there and run on the road. It was a little cold. And I said, get out there and run on the road because this is not going to get any easier if you don't just go do it. Mm-hmm. Same thing with having these quote unquote hard conversations. They're not going to get easier if you don't have them. You have to continually have them in order to be comfortable with them. And if that means role playing with an assistant, role playing with another hygienist, role playing with the doctor, whatever it is, role play so that when it happens in front of a patient, you're not scared out of your shorts. You're comfortable. Yeah. Because you've done it 100 other times that you are comfortable doing this.
And I think if you remember that this is your job, you're not diagnosing them with anything crazy. It's just perio. And yes, perio, but at the end of the day, perio can be fixed. It can be solved. It can be reversed. We can heal it. There's so many things we can do. It's your job. This is what you're looking for. Right. This is why you went to school. This is why you have a license. You are actively searching to make sure your patients are healthy. That's your job. And just doing them a bloody prophy is not teaching them. If you just do a bloody prophy on a patient who has perio, how are they ever going to learn that they need to change? Because it's not serious. It's same thing every 6 months and they're not getting healthier, they're not getting better. This is your job. Your job is to educate. We don't know this as lay human beings. We have no idea what perio is or why we get it or things like that. Some have heard about it,
Exactly.
but that's your job. So it shouldn't be a hard conversation. And if it is, like you said, Paige, get comfortable with it because this is your job. And I think it's important.
Right.
Hygienist, this is your job. Your job is to help diagnose perio.
And your license is on the line.
Your license is totally on the line. And if you know that that's what you're supposed to be doing, and I think hygienists, if you can just wrap your minds around this, that my job it's not just to give prophies, it's not just to scale, it's to educate and it's to talk to patients about perio if they have perio and to be actively looking for it, not giving excuses. I understand 60 minutes is a short amount of time, but I always question how come there are some hygienists who can full mouth probe every single time, even if they don't have the luxury of the two screens or anything like that. I see hygienists who, even in the most crummy conditions, they can still FMP once a year and chart it. They can still talk to their patients about perio. 30% of your patient base is most likely perio. That's just across the board. That's a standard that it should be. It doesn't mean it has to be, but that's the standard across the board of what most are. So if that's the case, and that's what we know, and I see a lot of hygienists, we go to over 180 offices nationwide, and I always question, if there's a hygienist out there that can do it, then it can be done. And I truly believe that. I think it's a lot of the times, I don't know, check yourself. And this might come across harsh, and I try to be real positive and upbeat on this podcast, but at the same time, check yourself. Are you just being lazy? I know that there are things, Paige, we talked about what your plan is today, and your plan is to clean the house today, right? That's your plan on your day.
Exactly. Yes.
I know when I have a big task in front of me, Mark Costas and I talked about this on a prior podcast, there are times when it's something I don't want to do that I will dilly-dally around so I don't have to do it. It's much more fun to get on the mics and podcasts than it is to clean my house. It is much more fun to go and conveniently need to go to the grocery store and buy all the groceries instead of going through my emails. There are things in life we don't like to do. And I really I question all the time, how come other hygienists can do it? And for others, they just say, I'm just too slow. I'm just this, I'm just that. And my thoughts are, no, you're really not, because the other ones are not these speedy, like they're not speedy McSpeedy. They're just a normal hygienist, just like you, but yet they can do the FMP. They can diagnose perio, but this one doesn't. And I honestly believe, and Paige, I want to hear your thoughts on this. I truly believe a lot of it is mindset and what we tell ourselves that we can or cannot do. And I'm not just saying hocus pocus, Pollyanna in the sky. I am saying I really do believe that if we tell ourselves we can't, there's no way we could ever do an FMP. There's no way we could ever have this conversation. That's true. You can't.
Exactly. Yeah, I totally agree. You have to believe in yourself and you have to tell yourself you can do it, and then you can. Like I said, it's not going to get easier unless you do it. And the other thing that I think plays a part in this too is doctors. Hold your hygienist accountable. If you have expectations, if you have these expectations for them to diagnose perio and full mouth probe or whatever it is, every appointment, hold them accountable. Hygienists, when your doctor comes in, have the perio chart up on the screen. Give them a recap of your findings that day. Okay, you've got to tell them you've been in the op with them for who knows how long. And the doctor walks in, you've got to recap. You've got to update them. Give them, the lowdown of what's going on in there. And doctors expect that of your hygienist, and they will do it. And if they're not doing it, here's a little tip. Kiera, this is your favorite tip here.
I do love this
doctors,
one. I love it so much.
If you go in the op and the hygienist hasn't done what you've expected perio-wise, pick up the probe.
Ooh,
start probing.
I love it. I love this so much.
As a hygienist myself, I cringe when doctors pick up a probe, especially if I haven't probed. Okay. And that's why I always do it every appointment now, because that has happened to me before. I didn't probe. The doctor came in, asked, and I said, I don't know. I don't know what the measurement is on that tooth. And he picked up the probe and started probing. And I was like, I'm running away. I'm never coming back. I'm mortified. I'm so embarrassed. And I thought, I'm going to start probing from here on out because I never want that to happen again. So doctors, if they don't give you a recap, you're going to have to figure it out yourself, and you're going to have to start probing. And hygienists, that takes away from the time of the appointment is when the doctor has to probe. If you just do it and give them a recap, that exam is going to be quick. If you don't, and they come in and have to reprobe, that's a long, embarrassing 10, 15 minutes that the doctor's in there.
Yep.
So
and you all of a sudden are the one who's typing in the 323 344. Yes. Shoot, I should have seen that for.
Yes.
I agree. I totally agree. And doctors, don't be too busy, because I guarantee you 1 or 2 times and your hygienist will instantly find the time to probe, because they do not want to have that happen to them again at all. It's not fun. It's not comfortable. And the only reason it's not to make the hygienist have, I do not want to embarrass a hygienist in front of a patient ever. But at the same time, I think it's huge that we've got to find a way. There has to be a way, and there is a way for you to be able to full mouth probe and to diagnose perio in the same appointment without it feeling like that's above and beyond. It's kind of when dads say, "Oh, I've got to babysit my kids," and I think they're just your kids. It's not babysitting. It's just being a dad or a mom who says the same thing, or whatever your role is. I always giggle at that, and I think that's kind of similar for hygienists of, oh, I've got to take the extra time to full mouth probe. No, it's not extra time. It's just part of your job. It's just part of what you do. So do it. And
exactly.
I hope that doesn't come across callous. We're not trying to say that, that's why I have to have Paige on this, because the reality is I have no clue. But I do know that as an assistant, there were things I couldn't skip steps. I couldn't make a crown prep go faster. I couldn't not do bond because we were running behind on a composite. Those steps have to happen because that's our job. Same thing when I'm up front in the treatment planning. My job, as much as it's crummy to check insurance verification, that takes a long time. For anyone who hasn't done it, get up front and go check insurance verification. It takes 30 minutes with the insurance company, and then they hang up on you, and it's super aggravating. That takes forever, but that's your job. And if you skip that step, it's a domino effect down the line. Hygienists, your job is full mouth probe to help diagnose perio and to give the patients an awesome experience.
Yeah. And Kiera, I'll tell you right now, the hard conversation is not letting them know that they have perio, educating them, recommending a certain type of treatment for them. The hard conversation comes 10 years later when the patient comes back in, has severe bone loss, mobility, and it's not treatable anymore. So you have to have the hard conversation of, you have severe periodontal disease. The next step is going to be extract that tooth, do a bone graft, implant, and a crown. That's a hard conversation to have right there. Telling them 10 years prior that you have perio, but it's, we can get you to a stable, healthy state and you can keep your teeth long term. That's not a hard conversation. You're just simply educating the patient. And what's the worst that's going to happen? They're going to say no. At least you told them about it. At least you educated them. Don't decide their outcome for them. If they come back in 10 years with loose teeth and they have to be extracted, you can say, you know what, Kiera? That is a real bummer. Dang it. You know what? We can take care of you. This is due to that periodontal disease that we talked about 10 years ago, but let's get you taken care of. Okay. Mm-hmm. Don't decide it for them. Don't think I'm just going to do a prophy and, not tell them about their periodontal disease. And then in 10 years, they have to spend a ton of money on something that you didn't tell them about. That is the true hard conversation right there.
I love that so much. That actually reminds me, I wanted to do Whole30. I still have never done Whole30, that you only eat whole foods and you have to be really dedicated and diligent with it. And I remember reading on Whole30, they said, people say Whole30 is so hard. Eating healthy is so hard. He said, and I don't drink coffee, but he said, drinking black coffee is not hard. What's hard is death. What's hard is losing a family member. What's hard is telling that patient 10 years down the road, you're getting all your teeth extracted. So I think putting it into the perspective of, is this actually a hard conversation? No, it's not. Now, I do know that there are some hygienists that will be listening that will say, but I've been doing this for 7 years. I have been seeing this patient for a long time. I've known they've had perio. I haven't wanted to have this conversation with them. How do I have this conversation? They've been seeing me for 10 years. I've just let it go. What do I say to them now? And Mark had a fantastic phrase that he used a little while ago, and it was, we now know. And so you just start with the present. You don't go back in time to, I didn't tell you, but it's, we now know that your pocket depths are 5s today. So with that knowledge, this is what we're going to do. And I love that there's no emotion, there's no backtreading. It is just very in the present. And Paige, you've got some good ideas for how to talk about that as well. What do you say? What's your kind of go-to script for that?
Yeah, so I usually just say something like, you know what, Kiera, based on your current situation today, or based on our current findings, based on what's going on in your mouth right now, this is what I'm going to recommend for you, right? It's not, oh yeah, I failed to diagnose Perio on you for the last 5 years, but my boss said I have to do it now. You don't say any of that,
Right.
It's just, you know what, Kiera, I totally understand. Let me set you up and let's look at your Perio chart based off of what we found today, or based off of your current situation and state of health today. This is what I'm going to recommend for you to get you back to health, get you to a stable, healthy condition.
I love it.
It's simple.
It's very simple. It's straightforward. And then you tell them what they need. Just like doctors recommending treatment. It's very straightforward. This is where we are today. This is based on your current findings. And we're going to move forward. So I had a doctor reach out to me this past week and he said, Kiera, what do I do if patients deny SRP? There's this whole debate of what do you do? Do you let them out of your practice, dismiss them? Because is that supervised neglect? Is it's better to do a prophy on them? And I think this is one of those hot topics in dentistry. And I don't think there's a true answer. But I do have an opinion. I'm sure Paige has an opinion on this of what I've seen in the past that I actually really, really, really like and I can stand behind. Paige, what do you do if a patient denies SRPs? What do you do with them?
Yeah, that can get kind of hairy because you don't want to lose patients over it, saying, well, then we're going to dismiss you from our practice. And then guess what? They tell their friends and their family and their grandma and their grandpa. They tell everybody, and pretty soon they've told 25 of their family members and you just lost 25 patients. So what I like to do, and this is also what you can talk about in your calibration meetings, this is a good topic, is figure out what you're okay with letting go and when you want to put a stop to it. So what I like to do is, inform them. And if they deny it, just educate them and say, okay, I totally understand that you're not quite on board. You're not ready to do this quite yet. Let's see you back at a shorter interval. Or you can see them at 6 months, but have them sign a document saying that they are declining the Perio, that you did recommend it, that you and the doctor did you co-diagnosed, and this was the final diagnosis, and this is what you recommended for your patient. They declined. And then you and your doctor can decide how many times you want to have that signed. And after that amount of times, you kindly tell your patient, you know what, at this point, your health is our main priority. This is how we're going to get you to health. But if you don't want to do it, that's totally fine. But we recommend that you either see a periodontist or that you see another dentist at this time, just because your health is our main priority and we can't get you there without doing this deep cleaning. So you just be very kind about it, but you're covered on your end. You're still looking out for the patient's best interest. You're not just saying, see you later. Maybe find another doctor for them. Call around. Don't just leave them hanging. Just leave them high and dry. Help them. Guide them in a direction. Maybe see this doctor. Maybe, whatever it is, help them so that they're not just alone.
I like it. I like it a lot. I think it's really just helping the patient see. I love to get on their page. I love to same side with them. So I love the idea of educating them and telling them. One thing I've done is I also like, and I recommend with hygienists a lot of times, that when you're saying your numbers out loud, have the patient help co-diagnose with you. Because if they're hearing and they know what they're looking for, they can then help and they can get on board. It's kind of the same as if you show an x-ray of a really good tooth and then you show a really bad tooth. They can help see, oh my goodness, I need to do this. So I think hygienists, even if you don't have somebody in there and you're charting yourself, say the numbers out loud and tell the patient, okay, 1s, 2s, and 3s are great. Anything above that, we definitely need to chat about. We don't like the 4s, 5s, 6s, anything above a 3. So listen for the numbers. I want you to co-diagnose with me. 323, 323, 324, 444, 444. They're going to hear all those numbers and then you can show them the Perio chart. It's a lot easier. And then you ask the patient, okay, what did you hear? I heard a lot of 4s. I heard 5s. I heard 6s. What does that mean? You said there's bleeding. They already have a heightened awareness because they're on the same page. So it's not as hard for you. And then from there, I've heard some offices and I really love this approach. Similar to Paige, I've heard Paige's way. I've heard some that just don't even talk about it. I'm not crazy about that idea. But this is another idea that I also really like. And if the patient, if they see it, they understand, but they're just not on board with it. And we've told them, we say, okay, you know what? We're going to give you 6 months. Here are the numbers. We're going to send you home with the numbers. These are the numbers. You know what we need to fix. So we're going to send you home. You educate the shenanigans out of them. You tell them what they need to do. And then from there, say, and in 6 months, if the numbers haven't gone up, we are going to do SRP. Like, that's the next step. We can't let you go by. Otherwise, we are not helping you in the best way. But we're on board. We're totally rooting for you. Go home, get these pockets. Even though those pockets when they're 6s and 7s are not going to get fixed. But at the same time, you just gave that patient a choice. They feel empowered that they're going to do it. And then they come back. They've got their little sheet of perio charting. Say, okay, here's your last one. I want you to listen in. Here we go. We're going to check your depths. And if they haven't improved, you and I both agree we're doing SRP. And they say, okay. But then it allows them to have that time. And then if they come back and say, hey, at this point, we cannot treat you. So if you're choosing to decline again, just like you said, Paige, let's send you over to the periodontist, because at this point, we would just feel so bad. We'd be doing you a disservice as a patient, and our job is to help you have the best healthy mouth. That's what we're here for. So, I don't know. There's lots of different ways, but at the end of the day, I think just being straightforward, not being skirting around the fact that they have perio, tell them what they need to do, be very confident in that. But like you said, Paige, I think the first step is calibrating you with your doctor, getting a solid perio protocol, which we have in our hygiene curriculum. We have a solid one. We talk to you about how to calibrate with your doctors, because if you're calibrated, then you've got the doctor backing you. You know what you're doing. You can move forward with that and have a lot more confidence there.
And then the patient trusts you as well.
Absolutely. I totally do. So, gosh, perio is one of those topics we could go on and on and on, but let's just do a quick recap. Paige, give us the 3 highlights from perio that you would strongly advise the hygiene world go into right now.
Yeah. So, calibrate with your doctors.
Mm-hmm.
Doctors and hygienists, have that meeting. It might be long at first. You might need to do 3 of them by the time you're calibrated. You might need to do 12 of them by the time you're calibrated, but you've got to start somewhere. Get calibrated. And trust each other. Okay. And then hygienists, give your doctors a quick periodontal assessment recap, even if the patient is healthy. That way the doctor knows exactly what's going on and you can move on. And doctors, pick up the probe if they're not giving you that recap. And lastly, don't be afraid to diagnose. It's really not a hard conversation. It's a conversation that needs to be had that will get easier over time. So don't be afraid. We are in the healthcare profession, and that's what our patients deserve. That's what we deserve. And end goal, we're just looking to establish health in our patients. So.
I love it. I love it so much, Paige. I know perio is a sticky topic. It's not black and white, but I really appreciate you giving a lot of good ideas and a lot of ways for us to help those patients. So thank you for joining me early in the morning. Thanks for putting off the house cleaning. Thanks for sharing. I'm excited for your marathon. I can't wait to hear your journey. It's such an awesome feeling. I remember my mom gave me a quote with the marathon, and I think this applies to all of life. And it said, there will be days where you can't run a marathon, but there will always be the marathon that you ran. And so it's the thought of, I might not always be able to run a marathon, but I did run a marathon at one time, and it's just an awesome feeling, and it's going to be great. It's going to be so good. It's going to be awesome. I can't wait for you.
I'm excited, but it's a long road, a lot of miles to put in. But it will get easier day by day.
But you're smart. I did not train. I did it in 2 months. I trained only for 2 months. And since then, I have wild knee pain. So I'm not going to ever suggest that to anybody. So you're doing it the right way. You're doing it great.
Well, thank you.
Exactly.
There we go.
Awesome. All right, Paige. Thank you again, everybody. Paige Benjamin, thanks for joining us on the Dental A Team. And everyone, thank you for listening in. And we'll catch you next time on the Dental A Team. And that wraps it up for another episode of the Dental A Team podcast. Thank you so much for listening, and we'll talk to you next time.